Thank you very much, Senator. And Secretary Shinseki, thank you for being here, as well as all your team. Secretary Shinseki, several times you and I have discussed my concerns about getting medical centers the resources they need to provide top quality care for our veterans. The Spokane Medical Center recently prepared a draft response to questions from the network about their budget, and they talk about the significant challenges of declining budgets, of numerous staffing vacancies, and leading the network in new veterans patients. And they said also, and I'm going to quote it, overall, senior management is very aware of the budget shortfall and is taking actions to limit the deficit. However, most actions will significantly limit staffing levels and access to care. These actions will have had a significant negative impact on morale and will drive some dissatisfaction among patients, end quote. Dr. Petzel, I asked you a similar question about a similar budget problem at Indianapolis at our hearing back in 2012 budget, and you told me there was no evidence that any medical center would be unable to provide the care that we all expect. Unless your view has changed, Spokane's assessment seems to disagree. And I wanted to ask you what you and the network are going to do to get Spokane the resources that they do need.
Let me turn to Dr. Petzel for details here.
Senator Murray, thank you. I am assuming that that's some employees' assessment of the situation. It's not the senior leadership's assessment of the circumstances.
It is the senior leadership's assessment.
I'm not aware of this. We do believe, and the budget was distributed back in October, and at that time, it was a consensus of the network directors and the facility directors that they had sufficient funds to...
The questions were asked to them of the VISN, and they responded back. So it was the senior leadership at the Spokane VA Center saying very clearly they do not have the dollars to be able to do the duties that they need.
Senator Murray, we'll have to go back. I will have to go back and talk with both the network and with Spokane. This is information that is new to me.
Okay, well, their draft response also calls for a discussion about the mission of their medical center. It asks if they're going to remain a full-service medical center and whether programs and services should be eliminated, and that is deeply concerning to me. Are there plans to reduce services at the Spokane Medical Center?
We have no plans to do so.
Okay, well, I need you to follow up on that and let me know what's happening, that they are facing such a budget shortfall. And it was very clear in the documents that we've seen that they are facing an extreme budget shortfall that is hampering their ability to care for the veterans in that region.
We will follow up.
Okay. I also wanted to ask both of you about the Walla Walla State Veterans Home. As you know, I'm very concerned about that, especially because the budget request proposes reducing funding for our state veterans homes grants. These veterans have been waiting a very long time for this facility. We have more than 1,000 veterans who need care. So I wanted to ask whether this system that we currently have is correctly prioritizing state home projects. Do we have enough flexibility? And how are we going to ensure that we've got the funds for state veterans homes like Walla
Walla? Senator Murray, you and I have discussed on numerous occasions the Walla Walla State Veterans Home, and I share your angst about that particular project. We are looking at whether there is a solution that will allow us to use the 2014 money in order to accomplish that construction, but we're not finished looking at what the alternatives are. And obviously, after we've done that, discussed it with the Secretary, we will get back to you.
Okay, we need to know where that's going, and overall, not just that one, but all of them, how are we going to deal with these veterans homes with declining budgets? I think that as members of Congress, we need to know what the need is, and then we need to figure out how to fund it rather than just being told everything's okay. So I want to know specifically about Walla Walla, what we're going to do, but the funding in general. And finally, and I know we have another vote, the war in Afghanistan is drawing close. We have more and more veterans who are coming home who are going to seek care at the VA. And we're going to be seeing this continue, I think, in the years ahead. I think we all have this thought that when the war is over, we don't have to worry about spending care on veterans anymore, and the exact opposite is true. A lot of veterans are going to come to the VA for the very first time in the coming years, and sometimes the conditions that they have dramatically worsened. So I'm very, very concerned about the budget request reduction in funding for TBI-specific healthcare and research. Why are you proposing to reduce spending on TBI care when we know that as these service members come home and their conditions worsen, they are going to be seeking care at the VA for the first time?
That's an excellent question, Senator Murray. If you look at the money spent in 2011, 12, and 13, there is a slight decline in that, which is projected to continue. The specific reason for that is that we've had a almost 70% decline in the number of severely injured traumatic brain injury patients that are going into our polytrauma centers. The number of people with moderate TBI has continued to increase.
That's right.
The cost of taking care of those people is much, much less than it is providing care for the patients that end up in our polytrauma program. So while we're going to be taking care of more people, absolutely true, we're going to be doing it at less cost because we are not going to be dealing with people that are so severely injured in the war. And the second thing is that the mild to moderate TBI patients, much of their care is absorbed in and seen in the mental health budget. When we're talking about PTSD, depression, and other mental health conditions, there is no relaxation of our concern about TBI.
All right.
This is
I just want to make sure we stay focused on that, and if we do see the costs are not being met, that we are aware of that situation sooner, not later.
Yes.
Okay. And Senator Isaacson, I know another vote's been called, and you and I need to go to the floor. I appreciate the time here today. Thank you, and thank you to our witnesses.